Hello everyone. Today I will be talking about Meniere's disease. I will be discussing what the disease is, including the symptoms that it presents, how this disease is diagnosed, and relevant audiologic assessments that can be used. I will also be presenting a sample audiogram from someone who has been diagnosed with Meniere's disease. And finally, I will go over some treatment options and other rehabilitation that is used. Meniere's disease is a disorder that occurs in the inner ear. This disease is typically only found in one ear rather than both. It occurs whenever there is a buildup of fluid within the labyrinth of the ear. Within the labyrinth, we can find the semicircular canals, the utricle, the saccule, and the cochlea. This fluid buildup causes a problem with the normal function of our balance and being able to hear properly due to the interference between our brain and inner ear. This is why we see the symptoms that people experience. Since the fluid buildup messes with the semicircular canals, people will often experience vertigo, which is extreme dizziness. These people will also experience a ringing in their ears, also known as tinnitus, hearing loss, and the feeling that they are congested within their affected ear. Since the symptoms of Meniere's disease are often seen in many other diseases and disorders, such as a migraine, it is proven to be a difficult disease to diagnose. The diagnosis is also difficult due to the fact that the cause of Meniere's disease is still unknown. Some researchers link it to the eye drops in the labyrinth. Some believe it to be linked to things such as allergies or autoimmune reactions, and others believe there could be a genetic factor. Since there is not yet one conclusive way to diagnose someone with it, doctors will look at multiple aspects of the patient's life in order to come to an accurate conclusion. One of the most important things that they will look at is the patient's medical history. They will also then want to evaluate the symptoms the patient has been experiencing, and based on how often they occur and which symptoms appear, they will then be sent to do more tests. Sometimes the doctors will want to order an MRI or CT scan in order to rule out other diseases that could be presenting these symptoms, such as tumors in the brain. There are 4 subtypes of Meniere's disease: possible, probable, definite, and certain. A patient is qualified under these categories based on the intensity of their symptoms and how frequently they occur. Once someone is suspected of having Meniere's disease, their audiologist will want to do some tests to see if the results are consistent with others who suffer from the disease. They will begin with a basic hearing test in order to see how well the patient is responding to different frequencies. Those with Meniere's disease typically have more difficulty hearing lower frequencies. The hearing tests that they conduct should include pure tone air and bone conduction thresholds, admittance testing, and word recognition scores. Another test that the audiologist might want to conduct, assuming they are specialized in it, is an electrocochleography. This test is not specific to diagnosing Meniere's disease, but it will look inside the patient's inner ear in order to determine if they have an abnormal buildup of fluid. These tests will not diagnose the patient, however, they will help lead the audiologist towards their final decision. On this slide, you will see a sample audiogram of someone who has Meniere's disease. Since one of the more common features in the beginning of having this disease is that the low frequencies are impacted more than the high frequencies, you can see that this person's left ear has a noticeable hearing loss pattern in the lower frequencies, which indicates the beginning stages of Meniere's disease. This will eventually flatten out so that the hearing loss is affecting all of the frequencies in that ear. As you may have guessed, since there is no conclusive way towards a diagnosis, there is also no cure for Meniere's disease. However, there are ways to manage the symptoms, and it is estimated that about 6 out of 10 people will get better on their own or were able to manage their symptoms. One of the symptoms that people want to manage the most is the vertigo. There are several medications that are able to either relieve the dizziness altogether or help to shorten the attack when it happens. Some people will try to combat their dizziness attacks by going on a salt-restrictive diet, which reduces the amount of fluid our body holds. In turn, this may also help the intense pressure in the ear that many people experience. Another way that some people believe helps their vertigo symptoms is the Menieres device, which is a type of therapy that is minimally invasive. This device sends pressure pulses through the ear, and these pulses are said to help stimulate the endolymph flow and help reduce vertigo symptoms. Typically only used as a last resort, some people will go to surgery in order to try to relieve their harsh symptoms. One of the surgeries that is used is the endolymphatic sac procedure, which is responsible for regulating the fluid levels within the inner ear. The regulation of these fluids will hopefully help the patient by alleviating their vertigo. There are several other types of treatment options, like steroids and other diet changes, but the overall goal of the patient is to be able to live a relatively normal life with these symptoms at bay. Hopefully one day we are able to find a diagnosis and cure those with Meniere's disease.